My typical day depends on what hat I have on. So if I'm in my researcher hat, I work on whatever projects we have going on at the time. At any given time, we have 3 to 4 small projects or research studies going on, and usually 1 to 2 big multi-year, multi-million dollar NIH, National Institutes of Health funded studies. When I'm a clinician, I see about 6 to 8 patients in a day. Right now, all those visits are via telemedicine due to the pandemic. In the before times, I would see people in person, but about the same number of people, and the visits are around an hour long. I would say at any given time, about 3 or 4 of my patients are living with IBD. Living with Crohn's disease is challenging and disruptive for sure. And, thankfully right now, I am in what they would call deep remission. So the impact right now on my day-to-day life is not that much, but it doesn't take long, or I don't have to go back far to remember what active disease is like and trying to navigate that as a psychologist. I've had to get up in the middle of sessions with patients to go to the bathroom. And I just was like, I'm sorry, I can't wait. Thankfully, I didn't have to be gone that long. And when I got back, we kind of just made a joke about it. People were a little worried, but I just moved on. And it wasn't as disruptive as it probably felt like it could be. I'm also a mom of 2 young kids, a 9-year-old and a 6-year-old. So I'm spread pretty thin. And so I need to have as much gas in my tank as possible. So maintaining this remission that I've achieved is really important. I do think living with Crohn's disease has made me stronger. It's definitely made me evaluate what's important and what's meaningful and what I want to spend my time on. I think if you asked my friends, my close friends and my family, they would say that I put out this air of stoicism, and I tend to not let on if I'm not feeling well. And I put forth this facade sometimes of strength. And I think part of that is because I'm supposed to be the one helping people. So oftentimes I do have to bury any issues I'm having so I can be there for my patients. Even with all the training that I have, all the knowledge of psychology, all the skills that I try to impart on my patients, I have definitely struggled with times of sadness. I've gone down some dark rabbit holes, and it's okay. And even us experts have a hard time sometimes. So it's perfectly normal to feel overwhelmed by IBD. Today, there are so many options, and it takes a lot longer to get into that situation of, oh man, this might be my last medication that I have left. That's been huge. So I'm very thankful for all the time and resources being put into developing these new medications for IBD. I would say I'm also hopeful that mental health will continue to gain attention and focus. And it's going to expand, I think, beyond the typical studies of anxiety and depression. I think by now in 2020, we understand that patients with IBD are at risk for anxiety and depression. But I want to see us get deeper into these topics, looking at things like medical trauma and post-traumatic stress disorder, issues faced by racial, ethnic minorities and LGBTQA patients, these types of patients that don't typically end up in our research studies. And so we need to look at that and get into what are the unique challenges that they may face. There's a lot of momentum right now, including in the realm of resilience and positive psychology, and why do some patients do quite well emotionally. So we really want to tap into all these areas, and I'm really excited to see what will be published in the coming years. Pay attention to what's going on in your head. Try not to wait until your mental health is really degraded or things are really bad in terms of feeling anxious or feeling depressed before you ask for help. We have to learn so much when you're diagnosed with IBD. There's a whole language that you have to learn, navigating a complex medical system, figuring out who your support system is all really overwhelming. So check in with yourself, see how you're feeling mentally. I tell patients that I see, and I've learned this through my own experiences, having a chronic illness, especially one like IBD, will really let you know who your friends are. And there can be a lot of loss associated with these relationships, but also a lot of surprises and, finding that person that you can be open with about your IBD experiences might be not what you're looking for. It might be with an acquaintance or a coworker or maybe a friend that you've stayed in touch with over social media, but isn't kind of there, in your main circle. It's finding that one person. It's about quality, not quantity, that you can share some of your feelings, especially related to like feeling isolated and stressed that we all live with when we live with IBD.